Yeah, good evening. My name is Prince Bull from Sierra Leone Civil Society. I just want to go again with what the director of OGI just said. It seems as if it's very sensitive, and therefore we want to take our time around it. I think where we're missing the point is maybe because we're asking for the drug, and there's no such drug. The fact remains that somebody was infected, somebody got better. So whether it was a drug or it was a clinical pattern, the fact remains there is also need to pay keen attention to details, as in, was it the drug that they gave to them or the clinical care, whichever we could use. So we want to replicate a pattern so that other people will be saved. The reason why she or some other people may be saying drugs to give or vaccine that exist, it is because, as it is now, like she said, the information that is given is a problem. So if it has no cure as at date, and then you get to a point where you eventually die, so she used guinea pig. If you have to die because you didn't have the drug given to you, drug in quote, or the vaccine in quote given to you, it makes no difference from you still dying from the Ebola if you didn't have the vaccine itself. My point is, let us have detailed attention to what happened and try to replicate the good example that happened. Thank you.
Thank you very much. Just yesterday, I lost one of my cousins who is a nurse. The situation there is extremely, extremely terrible. Most of the nurses are now not going for work. As doctor said, the morale is extremely low. And therefore, something needs to be done to boost the morale of the nurses. So many people will start dying as a result of other diseases apart from Ebola, because they are now afraid of going to the hospital. So if the nurses who are responsible to take care of the people are afraid to go to the hospital, it's extremely serious. And therefore, we need to do something to boost the morale of the frontline workers. I spoke to one of the relatives who lost, whose mother is a nurse. We need to think of innovative way as to how we can boost the morale of the nurses. It's key because the information we are getting this morning, there is an emergency meeting for all the health workers in Freetown. Because of Dr. Cole infection, the situation has become extremely, extremely terrible. So therefore, my own appeal here is, as the doctor have just said and one of my colleagues, let's find a way to boost the morale of the frontline worker, especially the nurses.
Good afternoon, everyone. My name is Mohamed Jallo. I'm not sure if anyone has asked this question before, so forgive me if I repeat someone else's question. I think the Sierra Leone government right now is going to have to multitask. By that, I mean it's going to have to tackle the expanding Ebola problem and at the same time quickly learn lessons to make sure it doesn't happen again. And in that light, I would like to ask if the government has initiated any efforts to find out who, what, or how this Ebola scourge came into Sierra Leone. Now, I have put out on my forum, Salon Discussion, findings that I publicly found from publicly available sources. These are the following. In 2007, a U.S. university Tulane started research in Sierra Leone at the Kenema district through an entity called the Mano River Union Research or something like that. Now, in 2014, so we know that the Tulane Research Project was funded in 2007 through a grant from the NIH. I may be mistaken on that, but they had funding from some U.S. government agency. It was about 3.9, maybe it was several $1 million. I can check that. And 7 years later, this research was concentrated in the Mano River Union states of Sierra Leone, Liberia, and Guinea. The research involved testing the first ever kits that had been designed by a pharmaceutical company, which will remain unnamed, to find out if someone is infected with hemorrhagic diseases, including Lassa fever and Ebola. It is a very strange coincidence that 7 years later, it was in those same 3 countries, for the first time in the history of Sierra Leone, that Ebola showed up. In, I believe it was 2 months, it was within the last 2 months, the Sierra Leone government suspended all testing at the Tulane University Research Facility in Canada. I am not sure if an explanation was given, but I would like to invite His Excellency to weigh in, or anyone else here, as to why that was done. And just 2 days ago, the United States government stopped all future funding for that Tulane University research project. The official explanation given was shielded by privacy rules. According to Reuters, the funding was suspended because of so-called technical deficiencies in the application. So, to me, all of those facts, and they are established facts, suggest that if the Sierra Leone government is serious about avoiding a future outbreak of Ebola, they have to answer the following questions. There are 3 of them. Number 1, did the Ebola outbreak in the same 3 countries where the Tulane University research has been going on for the past 7 years have anything to do with the activities of the Tulane Research Facility? Number 2, did the decision by the Sierra Leone government to shut down, in effect, all testing by the research facility run by Tulane have anything to do with the Ebola outbreak and the activities of Tulane there? If so, what is the nature of those activities? What is their extent? And what is the timing? Lastly, did the United States, or rather, does the United States decision recently to close funding for the same research projects have anything to do with the Ebola outbreak in Sierra Leone and the activities from that research institute? If so, what is the nature of those activities? What is their extent? And what is their time? Finally, is the Sierra Leone government going to start an investigation, even as it simultaneously fights this scourge? Thank you.